There we go.
Oh, hold on, I'm gonna mute my line.
Hi, everyone. How are you? Fewer people today. I'll try to keep things interesting so we keep you all coming. I just have a couple quick updates, and then I'm going to hand it over to Rick, who's going to give a readout on the CVS facility today and how that went. Basically, my only update is that we have 931 verified cases now and 27 fatalities. We're enthusiastic that the CVS site will help us get a better sense of what's going on as far as testing goes and be able to give more accurate numbers and an accurate picture of everything going on. And we're planning on starting to get those numbers through the state health department. So our expectation is CVS shares those with the state health department, and then we'll receive those numbers on an ongoing basis. I'd love to turn over to Rick, who can give a readout on how things went today at the facility.
Okay, good afternoon. Again, in partnership with the state of Connecticut and CVS, New Haven is the host community. Is a very successful first day. Yesterday was kind of some dry runs. Got about 75 individuals through yesterday. It was more of some of the first responders that were on duty. Today, looks like we'll get to a number of somewhere between 500 and 550. And that started off a little bit later this morning, just due to maybe some of the information not getting out to all of the public yesterday. It did get out this morning. I think it's important to note that this is going to be very workable over the next 41 days. There's a possibility that could change, but right now it's scheduled for 41 days. I think the important things to note are that our first responders can be handled as many of them were today through Region 2, along with they've also opened it up to residential care providers, nursing homes, and assisted living facilities. All those are considered frontline workers, as well as some state agencies. So that went really well. Right now, in order to get to the site, you really can do a couple of ways. You can go online with CVS, fill out a questionnaire, and be provided with a reference number and show up at the facilities. That's item number one. Number two, you can show up at the facility. If you do not, for some reason, you cannot get either internet or phone, there's a couple of ways to do that. You can, number one, go to the city's health hotline, 203-946-4949. Individuals can then register with the health department, and they'll get you through the process if you don't have a computer. You could also show up at the facility. We would rather individuals that show up at the facility that have no access to anything other than them walking up. We're going to try and discourage that. Another way you can get them is if you call 211. So 211 will get you through the process. They'll give you that reference number. If you are in fact disabled, if you have a disability and you cannot get to the site on your own, through 211, they will send an M7 cab to your home, bring you to the facility, and bring you back, which is key. That can also happen for someone who's elderly. It'll be handled just like a doctor's appointment. You'll have a doctor's appointment. They will schedule the pickup for you and return you home with your test results, which is key for us. I think the other thing is it's regional. So if you look at this, they're trying to do it by regions. Because New Haven was the host region, and we're in Region 2 in the Department of Emergency Management and Homeland Security, we went today. which is the first day. Tomorrow they'll then start the rest of the regions. So 2, 1, 3, 4, 5, then the state, and then next week again on Thursday it will be Region 2 again. I think it very, very successful day. Just a great partnership, and the state has never said anything but what can we do to help. So it's been again just a great collaboration and partnership between the state, CVS, and the city of New Haven.
Thanks, Rick. And obviously, we're really happy in New Haven. This is a regional asset. And when talking about the region, it's basically a statewide asset, and people from around the state will be coming to use the facility. We're happy that New Haven can be the place that opens up our doors and helps people out around the state to make sure that everywhere people have more access to testing. So with that, unless anyone else from our team has something to add.
I think I just have one more thing, Mayor.
Go for it.
If I can, I think it's important that there's no walk-up in any of the CVS sites throughout the country. There is no walk-ups. They're very clear about that. New Haven is the first time because it's in a city urban environment. We're testing this out for them. So there'll be a couple of bumps in the road, but the bottom line is this has never been tried before because most of them are in suburban areas. So again, this is a first time that you'll be able to actually walk up to the site. We don't want to encourage that, but it is available for individuals who have no other way and want to walk up.
Any questions from folks? Okay, I'll go with Gage. I don't have the option to unmute people, but if you could unmute Kyle, that would be great.
Hi, everyone. Thank you. I have a question about the regions that were just explained. Is it just going to be Region 2, which would encompass our area, and then it's broadened out day by day? And then, as it said, next week, it'll just be Region 2 again? Does it change per day?
Yeah, great question. Every day it changes. So today is Region 2. And then in 6 days, we'll be back to Region 2 because they're going to cover the other regions throughout the entire state of Connecticut. And those regions are what they call the Department of Emergency Management, Homeland Security regions, and they are Regions 1 through 5. We happen to be in Region 2, which encompasses a good part of Greater New Haven. There are 736,000 individuals over about 750 square miles.
Okay. And is that done to be helpful? So for just New Haven, to give New Haveners just the chance?
You know, I think it's just that the state had to come up with a system and a process so it could be fair to the entire state. I think the only thing as the host community, they allowed us to go on the first day.
Okay. And then another question, as far as the M7, is that for people also who don't have cars, or is it just for people with disabilities?
People who have no transportation. So yeah, if you didn't have a car.
Okay, great. And my last question is, I looked at the website earlier and it's for, it says you have to be a Connecticut resident. What about people who might be quarantining here, like students or other people who are here for a reason that are not residents? Are they able to get a test?
Yeah, you know, that's a great question. I do not have that answer, and I'm glad to get it and get the answer and get it back to you.
Okay, thank you. That's it for me.
Thanks, Kyle. Mary, and then we'll go to Tom.
I had the same question about the regions, and maybe there's a definition of the regions and what it encompasses. So someplace I can look it up.
Yeah, if Mary, if you go on the state's website, so just go to ct.gov /DEMHS, DEMHS, and then there'll be a regional map. You could probably just pull it up if you Googled, you know, Department of Emergency Management, Homeland Security regional map. You'd come up with it as well.
Okay, so when they put out their literature, all they did was describe it that you had to be 18, you know, meet the medical requirements. But then it was just open for people in Connecticut. So this is the first time I've read about the regions.
Let me clarify. Let me clarify that. So it is open to the entire. It is open to the entire state. So when you're calling in, and again, when you're calling in to make an appointment, you can call in from anywhere in the state, and they'll do you Monday through Sunday. But for our first responders, for the nursing homes, the assisted living, the residential care, those individuals go region by region. And so, because again, they didn't want to, I think the number is 100 first responders and then 50 from the nursing homes and residential care. So those are the ones, because they don't need an appointment. They can just show up as long as they have ID for the facility or their first responder community they work for.
All right, so so it's more limited actually then, right, for first responders. If you go on your region day, if you're a first responder, or assisted living, or
Yeah, that's correct.
okay,
It's on your region. It's on your regional day.
all right. So today, I mean, CVS was, I mean, they just kind of have a different public relations policy. Do you know which towns were represented today when people came there?
Which towns?
Right.
I'm sorry, I don't. But there were, I think there were a lot of first responders from within Region 2, and there were, again, I think it would be without looking at a list of individuals from towns, it would be hard to say what other towns participated. But I will, again, the first day got off a little bit slower because the information didn't get out last night. It didn't get out this morning, and I believe it is. They're told anyone within the state can register on the CVS website. Again, they're given that reference number and just could show up at the site with that reference number and go through the process.
Okay, because we have papers that are in Fairfield County. Will the first responders in Fairfield County, do they have a special day too? Is that region?
Yeah, that's Region 1, and they will be they'll be tomorrow.
Okay, maybe we can talk offline or something. It just, if it's not listed any place. Okay.
Again, if there was a miscue, I'm sure the first responders they'll do as much as they can to ensure that they're tested if they showed up on a wrong day.
Right. Because obviously those people seem to be the most important, and if you're exposed and you want to, on a Tuesday, you want to get there on a Wednesday as opposed to waiting for a region.
Yeah, they've been very flexible. I will tell you that the state has not said no to anything, and neither has CVS. So again, I wouldn't anticipate them saying no to a first responder. But again, they had to have some sort of semblance with organizing a different date. They didn't want everybody from the state to show up, and then it would be difficult to get residents in as well. So that's what they came up with as a plan to handle it region by region.
Okay, and the actual number today, it will be reported to the State Department of Health, so that's available to New Haven.
I believe that's true, and they expect 500 to 550 only because, and again, the hours of operation, although they have changed right now, the hours of operation will be 10 a.m. to 5 p.m. and you can show up at 9, but the testing itself will not begin until 10.
Okay.
And that's Monday through Saturday, and then 10 to 3 on Sunday.
Okay. There obviously wasn't a lot of traffic, I guess, really, right? In this
I got to be the flow. This Connecticut State Police, New Haven Police Department worked on a traffic plan before they put this into operation, and it was quite smooth, very, very smooth for traffic. Yes, we didn't see what in other states that they've had issues with. We didn't see that today.
Okay, thank you.
Mary, just to be clear, so our understanding is that CVS will share the test results with the state, and then that will be entered into the system that we use to track our test results. I don't think we've received any confirmation that the state will give us on a daily basis how many people have gone through the facility.
Okay. But you get an update every day on New Haveners, right, that are been tested?
Through the state DPH, yes. So a lot of different entities that do testing will share that information with the state DPH, and then the state will share that back with us.
Okay, and this will just be included. It's another.
That is our expectation.
Okay.
We'll know tomorrow.
Okay.
Hopefully.
Okay.
Going with Tom.
Thank you. Thank you, Director Fontana. I know I'm being redundant, but I just want to make sure that I understand. So any New Havener can register online and get tested potentially tomorrow or Sunday or Monday. They don't have to wait until next Thursday. Is that correct?
That's correct.
Okay. But first responders are following the regional schedule. Okay.
Yes, sir.
And then Rick, when you said that this is a kind of pilot walk-up testing site, now by walk-up, do you mean literally you can walk, or do you still have to show up in a vehicle in some variety in order to get tested?
Now you can walk up.
You can actually, okay. See,
You can actually walk up. You can't walk through the testing process. It has to be done in a vehicle, but you can walk up to the testing site, register, and if they can take you right then and there, which again, based on the number of individuals that are waiting, you'll get into an M7 vehicle, and they'll bring you right through the testing process. Yes.
thank you.
But
and
Tom, we
who-
prefer that not be your headline because we want to encourage people to take a car. It makes it a lot easier. And if people do need a vehicle, then they can call 211 and M7 will pick them up.
Understood. And who is working at this site? Are these all CVS Minute Clinic employees, or are there some city health staff or state health staff there as well?
So the individuals that are working the site are, so number one, all of the testing process is done by CVS employees. There are New Haven police officers, there are Connecticut State Police, and there is the 103rd Airborne out of Hartford. That's also working at the facility. But again, all of the testing process and the results are all done through CVS employees.
Thank you. And then, Mayor, my last question is obviously very quite a shift to have a new testing site on Long Wharf. But you've spoken in the past about potentially setting up smaller testing sites elsewhere in the city. Can you speak to either any more concrete plans you might have for that, or whether that's still a goal of your administration?
It is absolutely still a goal, and there's a number of reasons. One is that, as you heard Rick say, currently it's looking like the CVS site will only be in operation for 41 days. We hope that will change and be a longer period of time, but that's the plan right now. And as we've made clear in every one of these press conferences, we expect the virus to be present in the community for quite a long time. And the way that we tackle this and the way that we inch towards opening up is actually to have a very strong testing regime and contact tracing. And so we need to rely on other partners in the community to make that happen. We're having conversations with the community health centers and with some private entities. We're making some progress on that front, and we'll continue to do so. We're hoping that we can stand things up pretty soon, but these things tend to take a lot more time than you think.
And that's it for me. Thank you so much.
I saw Michael.
Good afternoon. May I ask a non-CVS question?
Go for it.
Have you or your team gotten any feedback so far from the retail front lines on the first day of the new rule for masks in retail stores?
I haven't heard a lot of feedback, no. I don't know if anyone else on the call has heard any feedback, but I have not heard a ton.
Any customers getting kicked out of stores because they weren't wearing masks or anything?
We haven't heard any stories, and honestly, that's not our intention. The ideal is that the store owner reminds people, hey, you need to wear a mask. And I think people pretty quickly, because what we're talking about is a face covering, can come up with a solution to make sure that they can get their shopping done.
Okay, thank you.
Thank you. Other questions?
Maybe just one.
Go for it.
Just a clarification. I mean, they really made a strong point that they didn't want walk-ups. But now you can have a walk-up. But essentially, does that person who's walking up get in a cab to get in line? Is that the M7 cab is there to take them? Is that right?
Yes, ma'am. That's correct.
Okay, so are they just always on call? I mean, it's probably not that.
Well, we think so. I think the understanding is that they'll have cabs at the site, but again, based on the number of cabs that are available, you may walk up to the site and they may have to say, "Look, you'll have to come back at a certain time." There's no guarantee that you'll be able to walk up and provide the information and get right into the cab. There may be a period of time that you may have to wait, or you may have to come back at a different time, but they're going to make, again, I'm like I said, they have not said no to anything. They've been really flexible. And, again, we want to discourage that, but we thought it was an important step to provide the ability for individuals that live here in New Haven, that don't have a car, that live close, they can just walk up. So I think it was, it was a huge factor in getting this.
By the way, the city also said you can call 211 and through them and arrange for a metro, right? If you qualify, I guess.
Correct.
I don't know if you have to be handicapped or elderly.
Yeah, I don't. Again, it's anyone who really could not get there on their own. So this was, again, just providing a level of transportation to anyone who could not get there on their own. So again, these are really new. Hasn't happened in many of the other sites that are up and operational. So those are suburbanites, and they pretty much all have vehicles. That's a little different now.
So the contract is between the state and CVS and Abbott. And do you know how much the contract was, or who's paying for this?
I don't. I do know that even the M7 was arranged through the Department of Administrative Services from the state of Connecticut.
Okay, thank you.
And just to be clear, Mary, the reason that the person in the vehicle is so important is that it helps protect the people that are processing the tests. My understanding is they open the window just a crack and they give you the swab, and then you self-administer it and then put it into some sort of envelope and give it back to the person. So the vehicle helps reduce the exposure to the people that are working on the site.
Okay, thank you.
You're welcome. Tom, you had another question.
Thought of another one.
I figured.
And
the longer we
since
wait, the more questions you think of.
Yeah. Not about CVS, about the career isolation shelter. I know that Director Fontana played a big role in helping set that up. And since we have him here, I'd love to hear from both Rick and from you, Mayor, about how things are going at Career, how many people are currently there, both residents and staff, and either any challenges or whether things are going as expected.
I think things are going quite well. We had some initial challenges around people that were reliant on methadone, and we've worked with that foundation to determine a solution to that. Rick, how many people are on site right now?
Right now we have 4.
4 people. But overall, it's been going well. It's been a lot of work that the team is contributing to the program, and we're really happy that we have that option.
And how many people are working there or volunteering there at any given time?
They're at any given time. So on the schedule, 24-hour schedule. So that they run 3 shifts: 7 to 3, 3 to 11, 11 to 7. There are 3 individuals that are inside the facility, 2 on the isolation side, and then 1 administrative person on what we call the clean side. There are also doctors that are there. They're not there 24/7, but they spend a lot of time there that are really specialists in a respite type situation. They're just, they've been very good to work with. I think it's been very successful. Again, a lot of volunteers, which made this so successful. The Medical Reserve Corps from Region 2 has been very instrumental in providing that level of service there. Again, I think the important thing is it has been successful, but it does take a lot of people to run. So other than the 3 that are there 24/7, there are multiple levels of different agency support as well.
And does that 3 include a city police officer or security?
So there are 2 police officers that are at the facility. They are both outside at both entrance and exits. There is a New Haven police officer there.
Great. That's it for me. Thank you again.
Thanks. Any other questions?
Yeah, this is for Rick. And at the beginning, I think you mentioned new groups that qualify, like first responders, for testing. you mind going over that again? I think it was assisted living.
Yeah, so what they're considering, not first responders, but frontline workers.
Okay,
Ones that were identified at this point have been, so nursing homes, assisted living, and residential care.
okay. And what does that qualify them for? I mean,
Providers are included in there.
I'm sorry.
Our homeless providers that are working 24/7, that are taking care of those who are displaced into hotels, they're included as well.
Okay. So if you have that status, what does that qualify you for as far as, does that give you different status for testing?
It actually just allows you, it allows you to go on the same day as the first responders and
Okay,
those frontline workers to be tested.
okay. Thank you.
No appointment necessary for those individuals.
Any final questions? All righty. Thanks, everybody. We'll see you soon.
Thanks. Have a good night.